Hello, everybody. This is Marilyn Francis. Thank you so much for joining our webinar today. I'm from the Patient-Centered Primary Care Collaborative, and I just a couple of things I wanted you to know. We will be sending a recording of the presentation today. If you have any questions, please feel free to use the chat box to type in your questions. And and as I said, we will be sending you the recording and also some handouts that we will have after the broadcast. So with that, let me begin. So So we're here today for the Enhancing Person and Family Engagement with the Parent-to-Parent Peer Support Program. Our speakers today, our wonderful speakers today, is Mary Minetti, who is from the Institute for Patient and Family-Centered Care. And then we have Jana Murray, who is the Executive Director for the Raising Special Kids in Arizona. So welcome. They're going to be giving you a really interesting and very informative presentation today. I just wanted to start with our objectives today. First of all, is to understand the importance of parent-to-parent, the mentoring program, and support to achievement of improved outcomes and satisfaction. And also to invite TCPI and non-TCPI clinic participation in linking families with parent-to-parent mentors. So how will we spend our time? First of all, we'll be setting the stage, having an understanding of patient and family engagement and how the peer support that parent-to-parent brings can help with that. And also we'll do an overview of the Raising Special Kids program, which is in Arizona. And then we'll do a review of the parent-to-parent support and opportunities for practices to participate. And then we'll also, at the end, have a Q&A session so that you can get some of your questions answered. So let me just tell you a little bit about PCPCC, or the Patient-Centered Primary Care Collaborative. Our mission is to promote collaborative approaches to primary care. And our main focus is on patient-centered care, person-family engagement, patient activation, and improved cost, quality, and experience outcomes. We're a part of the TCPI, which is the Transforming Clinical Practice Initiative that's supported by CMS. And in that initiative, we're what's called a support and alignment network. And it's a collaborative approach. We're using a collaborative approach with, like Mercy Care, our practice transformation network, for improving person and family, clinician, and community strategies for full engagement in their care, and collaboration as well as shared decision-making about healthcare. So as a SAN, mainly what we do is we provide like virtual and in-person learning events. We provide scholarships to conferences, coaching sessions, and we also integrate within the patient-family engagement the Choosing Wisely, which is the American Board of Internal Medicine Foundation program for helping patients have that shared decision-making with their clinician or healthcare team to decide what tests are necessary and which ones may not be. We also can offer expert faculty in the field of patient advocacy and community health. We also provide online tools and resources. And then also a very good tool that we help support is the IPFCC Patient Family Centered Care.Connect, which is a virtual community for patient partners. And it really can be a really nice medium for asking questions, getting information, and sharing information. So I think it's a really important tool, and I would encourage people to sign up and use it. So our basic message from the SAN is that person and family engagement is a core element for effective clinical care. One of the values that we bring is that we support the practice transformation networks and clinicians for developing patient, family, and community engagement capabilities. And the opportunities is for the PTMs to use the SAN assets for accelerating initiatives, in this case with the parent-to-parent, targeting cost and quality improvement. And we also try to make sure that people understand it's not just another thing to do. This is something that can really enhance clinical practice. And part of being part of the TCPI program, as you may know, we're looking at the different TCPI aims. There's 7. The main ones that we're focused on are improving health outcomes, reducing unnecessary hospitalizations, reducing unnecessary testing and procedures, and also helping practices transition into those alternative payment modules. And one area of focus for PCPCC this year is also collecting evidence that we can disseminate to practices for improving their work. And so with that, I will turn it over to Mary Minetti, and she'll start talking about the patient-family engagement.
Thank
Mary?
you, Marilyn. Thank you, Marilyn. And thank you, everyone who's taken the time out of your busy practice schedules to join us for this webinar. We really are hoping that as we line out the opportunities available to you, that you'll take advantage of them. So we're really focused on creating options and opportunities to support engagement of patients and their families in direct care experiences. And when we look at this particular slide, what I really want us to be aware of is that all practices are making efforts to engage patients and families on a daily basis, and that it's a continuum, it's an ongoing journey, and true north is that we move toward full partnership and shared leadership around the direct care experience through the co-creating of care plans, and so that really is where we want to go. But it often starts with how do we consult with patients and families and provide them with information that's useful to them, and then how do we move toward really truly involving them, because for many patients and families, they may have had limited experience in being full members of their care team, and so to just drop them into the partnership and shared leadership and have expectations that they would be confident in co-creating a care plan might be a pretty heavy lift for them. And so we want to do things to create small steps that really engage them so that they build the confidence, skills, and knowledge to be full partners as a member of their own care team. And so involvement is around how do we ask questions that help people understand and think about what really matters to them, what are their values and preferences and beliefs, and how do we share information in ways that are really useful and helpful to them. So in the TCPI Transforming Clinical Practice Initiative, there are 6 metrics that are being tracked for practices to think about, are we doing these things? Do we support patient and family voices in our governance? Do we do some activities at point of care? And what kinds of policies and procedures do we have to really support engagement of patients and families? And for the purpose of today's webinar, I'm not going to talk about the metrics and their definitions right now, but what I want you to understand is that there is a direct link when we talk about peer support to these metrics, because peer support can assist people in developing confidence around being part of the shared decision-making process. It can improve activation and address health literacy issues, as well as help people understand complexities of medication management and how other people have managed that. And so there's a direct link when we talk about peer support. It creates and enhances patient and family activation, because in peer support, we're building connections with other people who are outside of the healthcare system, who have a lived experience, who already have demonstrated some confidence and skills and knowledge in managing either their chronic condition, if we're talking broadly about all peer support, but in particular as we relate to parents, how they're managing the chronic conditions of their children. It helps people have an understanding of health and health literacy, because it links them with individuals who've had successful experiences navigating the healthcare system. And part of health literacy isn't just understanding the information about your condition, but it's also having the ability to navigate what is still a very complex healthcare system. And then it really enhances shared decision-making and medication management support, because people with a lived experience can talk about and share their stories of what really worked for them as they were dealing with having to make decisions about care, decisions about managing medications. Especially with kids with complex healthcare needs, medication management for parents can be overwhelming. The thing that is important for practices to understand, so there's lots of benefits to patients and family members when we link them with peer support, but there's also really benefits to the practice, because it really enhances care without creating undue burden for the practices. It saves time for the practice because there's an emotional lived experience aspect of dealing with a chronic condition that peers can answer questions and provide support, so that patients seek less from providers, not less medical expertise and perspective, but less expectation of that the provider is going to know what the lived experience is and share that experience with them. Now, occasionally providers do have a lived experience managing a chronic condition or having kids with health conditions, their own kids with health conditions, but that's a really small minority. And so this saving time so that the practice can do what the practice does best is important. It also can provide valuable information on conditions and practical tips around self-management and improved self-efficacy that are things that perhaps because a provider and the practice doesn't have that lived experience, doesn't really know. What we know in the literature and the evidence shares is that when peer support is effective, it often increases adherence to treatment plans. And that mostly relates to health literacy and understanding the importance of certain treatment options. It improves patient outcomes, and it also increases patient and family access to community resources. The peer supporter is a community resource, but often a peer who's living with a child with a condition has already access to other community resources, social services, and others that may not be within the medical arena, but are important supports for the parent. And so these are things that really help enhance care. So what is peer support? I mean, we've used the terminology a lot, but I want to just talk about peer support in terms of not just parent-to-parent support, but peer support in general, because the value of peer support is not just from parent to parents, but also patient to patient. Some of you may also work with patients. So we often think of peer pressure. If you've had a teenager, or maybe when you were a teenager, you know what peer pressure is. It's that which we gravitate toward our peers, and we model and emulate maybe their behaviors. And sometimes when we think about peer pressure in the teenage years, we worry that unfortunately our kids will be affected by a negative peer pressure. But even in teenage years, kids can associate with peers and have a positive peer pressure situation. And peer support has the same impact in a positive and activating way. Peers are two or more people who have a particular lived experience with a similar health problem or challenge. And the peer supporter, the person that you would refer your parent to be supported by, the peer supporter it's a role. And it's filled by a person who has a personal experience with a health condition, who is trained, and this is important. This isn't just, somebody's on the corner with we'll provide peer support, but it's a person who's been trained and is in some way supervised to support others who are experiencing a similar condition. And the purpose of that peer supporter is to share information, enhance emotional support, provide guidance on what worked for them so that people can see things more broadly, and help them connect with community resources. So as you can see with these quotes, the people who organize peer support programs think about it from the organizational perspective, but I think it's really powerful when a peer mentor can talk about what it is from their perspective. So practical experiential knowledge, connections, a deeper understanding and insight, that sense of I'm not alone. I'm not alone. Someone else has experienced this and they've made it through and they've developed some things, really reduces isolation and emotional distress. Those connections really help people connect with people who have shared experience. The feelings that we have when we're faced with a health condition or a crisis we don't know whether those are feelings that are normal. And so what happens with a peer supporter often is that it validates our feelings and experiences as normal or are expected. It's a person who can be impartial, who can provide support without judging the individual, someone to talk to so that questions can be answered, that people can feel cared for, respected, and heard and understood outside of the healthcare encounter, because we have our partnerships with our healthcare providers, but those partnerships are often within the context of an office visit, and we're living with the condition or with our child 24/7, and so being able to develop new relationships, develop new skills, and make behavior changes can be very helpful. And often there are benefits to the mentors as well. People can share how they've learned to communicate better and ask questions. They can learn how to deal with new realities with healthcare conditions. And mentors who have been through those experiences and developed some skills and confidence and ability can feel good about that they've kind of paid it forward and helped somebody else who, like them, is in a situation of having to deal with something that perhaps is difficult to deal with. There are quality and safety controls related to peer support. It isn't kind of opening up Pandora's box. It's really understanding that there is a difference in the role of a peer supporter versus the professional role. Professionals are extremely helpful to parents who are dealing with children who have disabilities. Professionals learn their trade, and develop their expertise by having developed knowledge from education and training that's quite extensive. They provide support to parents and other patients via counseling and problem solving and skill development training that they themselves have developed, and then they can share with those that they serve in direct care. A peer supporter's knowledge doesn't come from education and training, it comes from their personal experience. And the emotional support that's provided by a peer supporter is via the shared experience. We have this shared experience in common, as opposed to that professionals do provide emotional support, but it's through counseling and problem solving and those kinds of things. They're these roles are complementary. They're not in conflict, and so it's important to think of the peer mentor as somebody who is extending the reach and providing a different set of services than you would provide in your medical office. So as you think about, maybe I do want to connect with a parent-to-parent resource, or maybe more broadly, and you'll get a handout that you can download about peer support in general with some referrals for national reputable peer support organizations that are patient-to-patient peer support, regardless of whether it's parent-to-parent support or patient-to-patient support through peers. It's important for practices to understand the function and value of peer support. What value might it have to the patient? Because often patients and parents don't necessarily know that peer support is available to them. So how can you bring this valuable and unique resource to your patients? Well, one is that you understand the benefits, but it also is that you can include and have a readiness and willingness to utilize it in your regular patient assessments. So what that might be is developing a few questions that you can use to explore peer support with patients or parents. You might say some parents find it helpful to talk to someone who is dealing with the same situation of managing and being the healthcare provider outside of the office practice. The parent who has a child, is that something that would interest you? What you want to do is you want to create a bridge. You want to open a door and let parents or peers, patients in situations, be aware. It's important for you to know about national peer support programs that have chapters and affiliates, and that's a part of what Jana's going to do. She's going to really talk to you about the wonderful resource that you have for parent-to-parent support in Arizona. And the one thing that I would just bring to your attention as practitioners who are going to integrate peer support into your practices and make that an offer to link to community resources is to not make assumptions. Sometimes we think if somebody's highly educated, a parent is highly educated and they have a child with a disability, that somehow they don't really need to have peer support because they manage pretty well on their own. But actually, having been somebody who has received peer support, I can tell you that even though I have lots of education and lots of skills and knowledge in my field and in my profession, I have some understanding of a particular disease state. It doesn't mean that I don't need emotional support. It doesn't mean that I don't need to feel like I'm not the only one that's ever been faced with this situation. It's always nice to have somebody who has that lived experience to help connect with a person on an emotional level. And also to hear some tactics and strategies and practical tips that they have utilized that may not be ones that might work for me, but might generate my thinking about more broadly about what I might be able to do. So please don't discount the ability of peer support to be meaningful to people regardless of their educational level or their background. What I'd like to do now is I'd like to hand it over to Jana, who's going to spend some time really helping you understand how Raising Special Kids is organized, the kinds of great services that they provide, and what might be possible for you if you were to partner with them on helping create that bridge for parents to connect with them. Jana?
Wonderful. Thank you, Mary. I appreciate that. And good afternoon. I want to just take a moment and see if, oh, I did. I wanted to make sure I was able to advance my slide. Many of you may or may not be familiar with Raising Special Kids. We are a statewide organization, a nonprofit organization in Arizona that will be celebrating our 40th anniversary next year. So the beauty of the work at Raising Special Kids is we have a long-standing history of working with families in our state. We already receive lots and lots of referrals from other practices in our state to support parents that have children with developmental disabilities or special health care needs. So thank you for taking a moment to learn a little bit more about Raising Special Kids. The mission of the work that we do is to improve lives of children with the full range of disabilities and special health conditions by helping their parents become effective advocates. And we help them do that in such a way that it is strengths-based, that it helps parents with problem solving, and one of the primary ways that we do that is by connecting them with other parents. So as you can see there, it does kind of give you a snapshot of all of the supports and services that we offer families. Parent-to-parent support is the heart of what we do. In other words, it's almost impossible to put a price on it, on the value of parent-to-parent support. However, it has the largest, the highest level of social impact. Whenever a parent feels better and they have hope for the future and have seen that other parents have been able to find joy in their life and a healthy acceptance of their new normal, and that they are not alone, then they are better at problem solving and more effective. We, at Raising Special Kids, we also help parents understand the healthcare system. As you all know, our system is quite complex, and so we help them navigate through the various systems that their kids are eligible for. And then we are Arizona's Parent Training Information Center under IDEA. So in other words, we have a responsibility to help parents understand their rights and responsibilities whenever their child is accessing special education at school. We help them with training, with problem resolution, and then we help them develop their advocacy skills. So again, that they can be more effective, more confident and competent. And then we also help parents with coaching and education on managing difficult behaviors. This is a extremely valuable support that is a continuum, really, of support for parents whenever they're expressing that they have a child that has some difficult behaviors to manage. So when we talk specifically about parent-to-parent support, this is a model that describes forgive me here, that the research shows that parents of children with disabilities highly value peer-to-peer knowledge and support, and that it could not come from any other source, and that it is one of their most effective sources of knowledge and information. And once again, you can see there that we have been providing parent-to-parent support for over 39 years. And that this is an evidence-based practice. In other words, when we connect parents with other parents, there is outcomes that is supported with data. We evaluate the connection, and we do manage it. So I will talk about that a little bit more specifically here in a moment. We work very hard to prepare the parent mentors. In other words, we are looking for a parent that has accepted their family situation, that they have moved from that feeling of from the me to the we, to where they can look outside of their own family, that they can express joy for the future. We talk really openly about, are you comfortable with listening to other people's problems? Can I refrain from talking to others about the families that I'm supporting? So again, we make sure that prior to the parent participating in parent training to become a parent mentor, is having this open conversation about whether or not they really are ready to support another parent at this point in their journey. Along with that, we have a 3-hour training that the parent mentors participate in. These are some of the elements included in that training. We talk a lot about good listening skills, how important it is to be able to just listen. We spend some time on people first language, describing, not prescribing. In other words, it's not the parent mentor's role to tell the other parent what to do, but basically describe, well, these are the things that I did. These are what worked for my family. We talk about portion and moderation. In other words, if you have a brand new family that has learned of a child's brand new diagnosis, that whenever they're matched with a seasoned parent mentor, that parent mentor is not going to tell absolutely every historical fact about their journey. It's going to be just what's appropriate for that particular match. We keep track, we update information about the family. We can also offer support for follow-up if other issues are arising, because we're connected with the parent mentor. We do follow-ups with that parent mentor, and I will describe that in more detail here in a moment. We evaluate the match with both the parent mentor and the mentee. We also spend time talking about confidentiality and how critical it is to not share information about the families that they're supporting. As you all know, in Arizona, our disability community is quite small. And so the importance of not talking about personal situations with other parents. And then we also spend time on ethical guidelines, that these matches are not for the purpose of generating business or talking about religion or politics. And then this is what it looks like. It is individual mentoring and coaching for 8 weeks at least. It's confidential. It is open eligibility, offered at no charge. We also have parent-to-parent available in Spanish. We have a nice cadre of parent mentors that are bilingual and also monolingual in Spanish. They've participated in the exact same training. And again, we monitor and evaluate at 2, 4, and 8 weeks. And this is the best practice model for parent-to-parent support. As you can see, we receive referrals from many different areas. We actually have over 300 referral sources, but this is just a list of a few that refer to raising special kids for a variety of things, including parent-to-parent matching. So what might that match criteria look like? As you're working with families, you know, it may not just be a match for the child's diagnosis. Maybe it's an issue. Maybe it's a new season in the child's life. Maybe they're getting ready to experience a transition. As we all know, that transitions for most of us can be stressful. And so perhaps it's a parent that is having a child that's transitioning into adulthood, and they want to talk to another parent about, what are some of my options about, should I consider guardianship? Should I consider healthcare power of attorney? Those types of things. We can match on a variety of different issues. And this is really a snapshot. I won't go into the detail of what the process looks like, the parent-to-parent process, but I wanted you to have a visual of how involved and how handheld this match is, from the very beginning of the referral all the way to the very end whenever we provide the evaluation at the end, because we want to make sure that that connection was helpful for the family. So that's the importance of the evaluation. We have staff that monitor and supervise the parent mentors to make sure that there is continued contact throughout the lifetime of the match. And again, sometimes those matches go well into years and years because they have developed a friendship. But we want to make sure that it is at least 8 weeks. However, we are sensitive to the individual parent's needs. In other words, if we have a parent and a parent match where the support has been provided and they're good, they're ready to kind of move on, but yet they know that they can always come back, they can call back their parent match, they can call us. So we're always here, it's very open-ended for them to meet their needs. Our parent-to-parent protocol, it meets the best practice standards of the National Technical Assistance Center, which is our Parent-to-Parent USA. Raising Special Kids is a founding member of Parent-to-Parent USA, and we're very proud of that partnership. This is just some information for those of you that enjoy data. This is kind of just some evaluation data from our outcomes from last year. And these are the different areas that we evaluate. We want to make sure, again, that it was helpful and that the parents feel like if I need that again, I know I will go back for that. So, okay, so I think now, Mary, I think this one is back to you.
Great, thanks, Jana. I don't live in Arizona, but I have to tell you, you've got a very reputable, well-oiled organization that has developed some very high quality controls and provide really a wonderful service. And so what we want to talk about is, so we've talked about how important peer support is. We talked about the resource that you have in Arizona. So now we're going to ask you to consider something. You, along with a couple other states, we are doing some active recruitment and involving practices and considering this in a real way to engage and support your families and to connect to parent-to-parent peer support resources. So we'd love for you to become a pilot practice and receive some implementation support from Jana and her group. So let's chat a little bit about the kinds of services that are available in raising special kids and who's eligible. And Jenna, I think you're going to speak generally to that, and then I can fill in anything that might need to happen.
Absolutely, absolutely. So this is just a quick snapshot, a visual of how any parent in our state can receive parent-to-parent support, but providing some clarity about how that might look depending on how that parent is looking for support. If it is through the lens of wanting to talk to another parent about a child that has a behavioral health issue, or if it's any parent that has a child that has developmental disability, even with a coexisting behavioral health issue. But I'm going to talk a little bit more specifically about that in the next slide, just to kind of give you an idea. As parents from any of your TCPI practices, this statewide resource here at Raising Special Kids is available for all parents. That insurance is not an issue, that if as agreeing to participate and practice will help evaluate the process. So that's the role of any of the TCPI practices, any of the parents that are involved in your practice. All other parents that live in Arizona or have a child with a special health care need or developmental disability can receive any support from Raising Special Kids. And then also we have a brand new, in its baby infancy stage, we have a new contract as a community service agency where any families covered by Mercy Care and the referred parent has a child with a behavioral health issue, the parent mentor also has the shared lived experience of having a child in the behavioral health system. And that parent mentor that they're matched with has received a higher level of additional training and has been credentialed as a peer mentor. So those are, that kind of gives you a snapshot of how any parent in Arizona can receive parent-to-parent support or connections to Raising Special Kids in that really nice, broad, wraparound way that we can support families. And really, this is my purpose for sharing this with you, is to let you know that there is no wrong door for referring a family to Raising Special Kids. You refer them over and we'll take care of figuring all that other stuff out for you. So now, Mary, I believe this is back over to you.
You bet. So I'm hoping that many of you on the call are excited to talk with others in your practice about being involved and utilizing this wonderful resource of Raising Special Kids and making it available to your parents, making them aware of it. So what's the practice's role? So what do you have to do to get this great benefit? Well, all we're asking is that the practice agrees to participate and identifies a key contact, and that you complete a referral form with each parent identified, and that you fax that referral form, and one of the handouts you have that you'll be able to download is both the Spanish and the English referral form, and that the practice provides some feedback on what the experience of making a referral via phone survey would happen at 3 months. So really, to be involved in this particular pilot, you just have to be willing and interested and provide us information so that we can both get the match made, because that's the most important thing, isn't it, to support that parent, but also that we can get some feedback from you about how to make that experience from your perspective easier and better. Now, there are, PTI is a practice transformation network that works with you and provides technical assistance, and they're going to share some information with other practices that weren't able to be on this call today, and make sure that they have access to referral forms so that they can also be involved in making referrals. They're also going to assist practices in reporting their PFE strategy on the practice assessment tool, or reporting it on adoption of PFE metrics. Because earlier I said, you know, it's related to activation, it's related to health literacy, it's related to supporting people in shared decision making, and you are tracking what your practice is doing in those arenas, and this is something that could be tracked and you can get recognition and acknowledgement for. And PTI also is going to help us identify which of the referrals that Raising Special Kids has is a TCPI site. So you don't need to write a bunch of different information on your referral form. They'll help us make the connection. And then Raising Special Kids is going to process all the referrals. They're going to match parents. They're going to notify the practice of the status of referrals so that it's not going to be this black hole where you fax something off and you never hear what happens. And then they're going to conduct a satisfaction survey of patients or parents that are referred. And you saw the great feedback that they've gotten in just the last year in terms of 4.5 on those key domains that create support for parents. And I, from the Institute for Patient and Family Centered Care, will conduct some phone interviews with the practices on their experience at 3 months. But they're very short interviews with just a couple of questions about the ease of referral, the timeliness of the referral, and any feedback that you've gotten from families about their experience. And that's why we need to have a contact person. Overall, we are going to track this. We're not going to ask you to track it. We're going to track the number of practices that have participated, number of families referred and matched, and again, the time period from the first parent, from getting the referral form to when the first parent mentor contacts that parent. And then, of course, the parents are going to talk about what their experience with the parent mentor was. So we want to know and learn from this, this new relationship, how it's going from all aspects. So what we really are interested in doing now is opening it up to questions so that if you have questions about peer support generally, about raising special kids, or about how to make sure that people, that you get the information you need to provide connections to patients and parents for peer support, we want to make time to do that. So I'm going to open it up to questions, and Marilyn and I believe you were going to manage the chat box or the Q&A.
Right.
Hey there. Yeah, so if you can either put your questions in the question box there in your little control panel, and Marilyn will read them out, or if you would like to be able to speak and share your questions via audio, assuming you've kind of attached your audio correctly, you can raise your little virtual hand on your screen there, and then we'll unmute you so you can use audio that way. Either way works for us. Lines are open.
Don't be shy.
So one of the things that I noticed is that Lauren has uploaded into the handout section the slides that we've just shared with you. And I mentioned a couple other handouts that haven't yet been uploaded. However, we will make sure that when an email is sent out to you, because you did register to participate, that those two, the referral form from Raising Special Kids will be attached, as well as the peer support flyer with just general information about national peer support.
And we'll make sure those are also attached on the website when we post the recording online. We'll have them there as well.
Right. Perfect. And we have a couple of questions. One is, if we want to participate in this pilot, who should we contact? I think the slide deck does have contact information.
So go ahead, Jana, were you going to answer that question?
I can answer it from our perspective here at Raising Special Kids. I would be your contact if you are interested in participating, but I believe we would also be connecting with Mary to ensure that we are collecting the appropriate information to provide her with contact information to conduct the evaluation calls at the end of the pilot.
And we'll do that all behind the scenes. So if you fill out your referral form and you fax it to Raising Special Kids, then we'll behind the scenes do all that we need to do in order to make sure that we get all those other processes in place. We want this to be the least burdensome that it can be, and the most important thing is making that connection between the parents so that they get the support that they need and the support for their engagement in their child's care.
And I'd like to add to that, Mary. Oh, I'm sorry. I'd like to add to that, Mary, that the beauty of filling out the referral form is it gives us enough information to be able to reach out to the family more effectively. That we're asking for the good contact information, and then also contact information from your practice, from the referral source, whether it be email or phone, so that we can follow up with the practice to let you know the outcome. And that's a really critical connection that we would have with you as the referral source.
Okay, we have a couple more questions. Let's see. One is, do you find that parents who have been involved in parent-to-parent programs are better equipped to work with their medical team and participate in decision-making?
Absolutely, absolutely. Parents oftentimes report back that after they've had those emotional needs met by having that really nice, valuable connection with another parent, it gives them hope for the future. And when a parent is able to see that there's light at the end of the tunnel, that another parent has been successful and is able to express joy and hope for the future, then it makes them far more effective on those decision-making teams, whether it be their medical teams, whether it be their team at school, whether it be their IEP team, or maybe perhaps it's even their team through the behavioral health system, their child and family teams. But they absolutely express an increased confidence and competence in being able to navigate through that.
Okay, great. The next question is, would someone be willing to come out and speak to our teams on this? This is Jody Stone.
Absolutely. Yeah, Jody, just send me an email and we will get that set up. We do that oftentimes with practices. We can have a Raising Special Kids staff person come and provide an overview of our organization and then also materials for your practice. And that's another important connection, is that we would be able to bring materials to your practices that you can provide to families. And it's materials that is information about raising special kids and our newsletter and other types of information that might be helpful for the family.
And her follow-up question is, would you be willing to attend a parent advisory group then?
Absolutely. Yeah, absolutely. And actually, that's interesting that you say that, because we were approached by another practice several years ago, actually, to help them develop their parent advisory group. It was a particular practice that was really trying to start a parent advisory group in a very effective way. And so we were able to kind of partner with them and help them identify parents that could participate, and then also help them to set up the advisory group in such a way where they have job descriptions, they have a really tight agenda, that they pay attention to timelines, and help them with identifying parents that would be effective in those types of roles. The other thing is, too, we can also provide training to the parents that participate so that they are more effective. Again, it's important for a parent to know what is their role when they're serving in a group like that, and so that's another thing that we can help support.
Fantastic. And then last question we have, are there any costs associated with parent-to-parent matches?
There is no cost. It is at no charge to the parent.
Okay.
Or to the
I think that's right. That's important. So let's see, Kim just asked, what about cost to the organization? I'm thinking that may be the practice, no?
So in terms of cost
Yes.
to the practice, there is no charge for the practice to be involved and to make parent-to-parent, you know, to fill out a referral form and send it. The cost is time and the identification of what is going to be your process for making those referrals. You're going to have to, as a staff, decide, are we going to centralize that? It may be that you'll build on your current referral process and that all referrals will be, you know, go through a certain process that you already utilize because you have a referral specialist, depending on the size of your practice. But what we know from parent-to-parent and peer support is that over time, it saves time for the practice if we make referrals to community resources that meet needs that are best met by those community resources, so that the parent, in this case, doesn't expect the practice to have that level of expertise around what it's like to have a lived experience. So it's a good thing. So if you put all of that stuff together, then there's not even a time cost because you're providing a service to help them connect to that community resource.
Okay, I don't see any other questions in the chat box. And are they able to talk?
Yeah, you can talk if you want to. Just raise your hand there. I can unmute you. It looks like no one's done that, but if you would like to chat, you can.
But if there is,
we have just a couple slides. Maybe if there's no more questions, we can kind of wrap it up.
okay, all right. Okay, just a couple of things. I just wanted to go over some resources that are available. The PCPCC website, we have a patient engagement tab on our website that will provide webinars, tools, and resources to strengthen your efforts in patient-family engagement and parent-to-parent. And as I said previously, we will be posting this webinar on our website so that you'd be able to listen to it again, or you can share it with other people who were not able to make it. These are also some websites for the Institute for Patient and Family-Centered Care, and then Peers for Progress, primary care resources. And as I said again, the PCPCC website and the IPFCC website really do have quite a few tools and information that could be of value to you, as well as the Parent-to-Parent USA website. The PFCC Connect, I was talking about that earlier. It's a really nice learning community. Lots of information that it's exchanged, and I would recommend you signing up for it because it's a really good way of, it's a really good tool, and it's a really good way of learning what's going on in the field. I'm sorry, Mary, were you going to say something?
Oh, I was just going to say on that last slide that really is for people who are interested in exploring peer support in more detail and finding out the national organizations. We have on our website best practices for peer support, as well as information for organizations to connect to national resources. And Peers for Progress is really a best practice site for those of you that are in primary care that are on the call for other kinds of peer support outside of parent-to-parent support, which you're going to get from raising special kids. That's all.
Okay, thank you. And so, again, I'll do another plug for the pfcc.connect. And so, thank you very much. I want to thank Mary and Jana for a great presentation, and I thank the audience for attending. Their contact information, as you can see, is on this last slide. And I just want to say there was just one other question that just came through. Is there a way for the provider to capture referrals from the peer-to-peer? For the community resources, so it can be captured for reporting.
Is the question that the provider wants to know of the referrals that have been made, how many resulted in a a parent-mentor connection? If that's the case,
Yeah.
then Jana's going to be providing that information real time with each practice based on each referral. So if the practice wants to gather that aggregate information as we give them feedback, then they could certainly have that available to their reporting.
Right. Now, actually, they were asking if the peer refers the parent to another organization, is there a way for the provider to capture referrals from the peer-to-peer community resource so it can be captured for reporting? Does that make sense?
So beyond beyond the parent-to-parent match made, if the peer says, I suggest you go to an organization like the Y or something down the road to do X, Y, Z. I think the only way to respect confidentiality, Jana, I don't think you probably capture that, do you?
We don't, because I believe that many times when parents are connected with each other, they talk about what other community resources have worked for their family, and we don't have a way of knowing, you know, that conversation that was had. I mean, like, for example, a parent may say, I loved this particular swim lesson school or this particular organization really, you know, and so there really wouldn't be a way for us to be able to track that. I think that one of the things that's really critical is we do help the parent mentors understand the importance of a referral, or not a referral, but a suggestion of, because it really isn't a formal referral, but a suggestion of a resource that has worked for their family, that it is a credible, reliable resource that still exists. Because one thing can be really frustrating for parents is to, you know, reach out for a community resource and they no longer exist. So we do talk to them about that. But I think to answer your question, I'm not sure that we would have the capability to be able to capture all of those conversations.
Right. Probably the most direct way would be for the provider who made the referral to the parent to ask them if they've been connected to any other resources. And it would really be a one-on-one as a follow-up when you see the parent next. Right.
And that was the statement made. So yes, the provider could ask the parent. So very good. And so one last question. Says, regarding capturing the referral, the referral would be if at future visit, the patient, I'm sorry, it's a little bit broken up. They would have to go through practice learning directly from the referred parent. So in essence, what they were saying is pretty much what we just said, that the provider would need to ask the parent the next visit. And it sounds like it's something that should be done fairly consistently to see if there are other community services or other services that the parents have been recommended to. So that would be the best way to capture that data. Okay. All right. Well, thank you. We're at the top of the hour. Thank you so much for attending this. And again, thank you, Mary, and thank you, Jana, for providing us with a really educational and very interesting seminar here. I keep saying seminar. It's a webinar. Anyway, everybody enjoy the rest of your day. And as I said, we will be sending out a link to the recording of this webinar, and we'll also be sending a copy of the slides as well as the handouts. that didn't make it onto the website today. So you should be getting that probably in the next 2 days, okay?
Thanks so much.
All right. Okay. Well, thank you. Enjoy the rest of your day. Okay.
Thank you.
Enjoy the rest of your day.